Hello, my name is Lachey, and today I'm going to demonstrate the use of a feeding pump. Alright, so we've already checked the MAR. We have the right route, the right rate, the right type of formula, and we have the right client. I've already performed hand hygiene. I have also went and assessed her for her allergies. I made sure that I checked her bowel sounds, which they're active in all four quadrants. I've also made sure to sit her up at a high Fowler's degree angle, and I have also checked her residual, and her residual is within the acceptable parameters. So now what I'm going to do is just don my gloves, sat her up, did all that. Okay, so I checked the doctor's orders. I filled up my bags here. Okay, so let's just say these bags are full. I'm hanging them up, and before I hang them up, I want to make sure that I'm putting the my name or my initials, the time and the date, so that way the next nurse coming on will know when to change this. All right, and without this being on the floor and making sure that the cap is on the tube, we want to just place the tubing properly. So bringing this in here together like this. And then we're dropping that, placing that in here, just like that. And then we're wrapping it around. We're going up, okay, and then we're bringing that out. All right, so that is in, the tubing is in. Okay, now what we can do is just turn this baby on. And now what we want to do is prime this. We're going to go ahead and prime this. We can either auto prime or manual prime. So as we're priming on auto, we're just making sure that the feeding is coming all the way down to about the tip here. All right. And as I said, we've already checked the client's residual. We've already assessed her bowel sounds. We're priming. Okay, now we can stop because it's here now. So now that we have done that, we can go ahead and flush with 30 milliliters of water, which I did. And then we're going to go ahead and hook this up. And having a chuck underneath my patient before I open up the tubing, I'm going to make sure that I insert it into her tubing, and then I'm going to set up the feeding. So I'm going to click adjust feed here, adjust feed rate. The doctor's order says she'll be getting 250 milliliters per hour, so we can bring this one up. 100, 200, we're going up to 50. That's 250 milliliters per hour. Enter, and then we can begin this feeding and run. So now it is running and she's being fed. I'm also going to assess the patient's tolerance for this. Take off my gloves, wash my hands. She's fine. Leave her in lowest position. Leave her crawl light, document, and that is it. Okay, now I will demonstrate the insertion of a nasogastric tube. Before we begin, I've already washed my hands, and now I'm going to check the physician's orders to make sure that I have the right tube. I'm going to make sure that I have the right indications for this tube being placed. I'm also going to make sure if the client has a specific nair that they wanted in, that I make sure that I write that down before I go into the client's room. I have all of my supplies here with me. I have my chuck, my tape for measuring, my pH strips, my filter, my tube strip and lubricant jelly, 60 milliliter syringe, my glass of water, and my gloves. I want to make sure that I am also verifying that I have the right patient. I will check and ask her name and date of birth, and I can also scan her name band. I'm then also going to explain the procedure. So I wash my hands. Hi, Susie. I'm going to be inserting this nasogastric tube, and I'm going to need your cooperation, okay? I will assess her bowel sounds using my stethoscope. So I'm assessing. Okay, her bowel sounds are active. I'm also going to make sure that I am looking for the patency of her nares, making sure there's no bleeding, no occlusion, and I'm also going to sit my patient up in a high Fowler's position. Once that is done, and I've checked everything that I needed to check, I'm going to wash my hands again, place my gloves on, and I'm going to just kind of inform her about her cooperation. So Susie, for this procedure, I'm going to need you to hold your glass of water, and well, actually, I can explain it to her after I measure this. So we're going to measure the tube from the tip of the nair to the earlobe. And also remember, she's in a high Fowler's position from the earlobe to the xiphoid process. Okay, so I got 57. I'm then going to mark this part of the tube with my tape, or I could use a small marker. So I've marked it, and now what we're going to do is we're going to place our filter on before we insert this. So we have our filter, and then we're going to put the blue with the blue and the white in the clear. So it should make a loop just like this, and this is just to prevent the contents from coming out and shooting out at us. We also want to make sure that we cover the patient with a chuck. In this case, I have a towel. And remember, she is in high Fowler's position. And so we also have her glass of water here. So what we're going to have her do is explain to her that we're going to need her to hyperextend her neck first. And once she starts to cough or gag, we're going to have her flex her head or put her head down. And while she's doing that, we're going to encourage her to swallow. So before we begin, I want to make sure that I have my 50 to 60 millimeter syringe, but I want to make sure that before I insert this, that I lubricate this. So we're going to place this in about 3 to 4 inches of lubricant. Okay, 3 to 4 inches. I'm having her sit up. She has the cup of water and the emesis basin with her. All right, Susie, I'm going to go ahead and put this up on the count of 3, going in, being careful not to just shove it into her nose. And we're going in. Her head is hyperextended. All right, she's gagging, so I'm having her flex her head and swallow her water as I'm going down. Need you to swallow, 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 swallow. Now, if I were to if she were to start coughing, I could just pull this about 1/8 inch back, going up, and just swallow, 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 swallow. It's going in to the point where we have marked, and it is there. Okay. Now I can place my NG Secure tape over the tube, which will be over her top lip. So we're just placing it there. Now, I don't know if you can see that, but I've placed it in. Okay, now it's in, and all right, it's in. So the next thing that I want to do here is I want to check to make sure that it is actually in her stomach. So we have our 50 to 60 milliliter syringe, and what we're going to do is we're going to just take this off. We're going to draw back a little bit. We don't need too much, but of her gastric contents. Say I got about 5 milliliters. Okay, and what we're going to do is place this in our cup here. placing the gastric contents in. And we're going to then check the pH. For the pH, we want to use this strip, and we want to make sure that it is a 4 or below. And this will determine the acidity level, which can indicate that it actually is in her stomach. So I'm checking the pH, comparing it to the strip color card, and I got a 2. So this is a strip. I got a 2. Okay. And now I can go ahead and keep her sitting up like so. I'm then going to order a x-ray to be done, because that's actually going to determine if the tube has been placed properly. I am then going to dispose of the gastric contents. There's no need for us to put them back into her stomach. I've already ordered her x-ray. I'm then going to document the procedure, and I'm going to wash my hands and leave the client in a comfortable position and give her her call light. And that's going to be the end of this. Thank you.